coming, everybody. I see that Joe Buell's probably still in his room sleeping. Particularly, I'd like to thank Dr. Pitt for coming out. And it's always tough to give a talk on a subject where you know you have an international expert in the room who knows a tremendous amount more than you. So hopefully I don't say anything that is totally at odds with your philosophy. But this really is one of my most, probably the things that interest me the most in medicine. And this came out of a conference we had last year, which was sponsored by several surgical societies. But the topic really is, what are these patients who are borderline resectable? And I'll get into what borderline means. Why is this important? Some of the objectives. Why is this important to you guys? Why should you be paying attention? Why is it interesting to me? Which patients can we help? And we're going to go over some of the outcomes analysis. There's not a lot of clean data out there. Most of the data out there, unfortunately, is tainted by non-standardized resections, non-standardized pathological examinations. And so I'm going to try and piece out some information that might be useful. And then, importantly, I'll show some pictures, so hopefully everybody doesn't fall asleep. So Dr. Stalo set the background, but just for everybody, a little bit of background. This is probably one of the better series. This was published in 2008, which is really MD Anderson's collective series for the past 17 years or so. This is stage-specific survival. You can see months from diagnosis, all patients, all comers, median survival with pancreas cancer is about 9 months. Okay, that's not great. For early stage 1 and 2, overall is 15 months. And those patients who are fortunate enough to have a pancreatic duodenectomy, median survival overall is about 24 months. And I would argue that it's probably, in their series, you'll see that it's actually higher based on nodal status. Patients who weren't resected for whatever reason with early stage, let's say comorbid factors, per patient's preference, median survival about 10 months. And those patients who have what we call locally advanced or stage 3, that is tumors that have grown into vessels that we can't resect, have a median survival of about 9 months. Okay, so that's not great, and that's why surgeons and oncologists and radiation oncologists, everybody who takes care of these patients, are trying to get more patients to be resectable. That's the whole point. Obviously, patients with metastatic disease have about 6 months to live. So what does borderline resectable mean? Borderline resectable basically means a cancer that can technically be removed, but is probably higher than likely to have positive microscopic margins. And what we really need is objective criteria to really be able to study this further, because we don't have really good, there certainly are no randomized trials. Some definitions, the NCCN guideline definitions is borderline is tumor abutment of the SMA, which is less than 180 degrees, severe unilateral SMV or portal vein impingement or short segment occlusion, which will be in the new version, and then